Hi there, my name is Fraser. I am a neuro and older adult specialist physio at Simpson Physiotherapy, and today I am going to give you 5 top exercises that we see help a lot of adults reduce their risk of falls and improve their walking as well. Okay, so a little bit about me. My name's Fraser. I am a specialist physiotherapist who works with adults with neurological conditions and with older adults who have challenges with balance and falls, helping keeping them independent and living on their own in their own home. One of the big things that we see, onto today's video, by the way, one of the big things that we see when we come out to see somebody that is actually having challenges with their balance and falls is very often deconditioning. Okay, as a natural part of aging is we naturally lose muscle mass year on year. The posh term is called age-related sarcopenia. And what this means is from the age of 40, depending on the person, you can lose anything up from 0.3% up to 3% of your muscle mass year on year. It's the reason why bodybuilders like Arnold Schwarzenegger, when they're in their 70s, 80s, physically are unable to maintain the same muscle mass that they could when they were in their 20s and in their 30s. And that's because as a natural part of the aging process, what happens is we reduce the amount of muscle fibers that we actually have. There's nothing that we can do that stops that. That's something that's just a natural part of us getting older. What that means is that the muscle that's there, that we still have left, is trying to do the same work that the muscle that we had lots of before when we were in our 40s and 50s, and now we're maybe in our 60s and 70s, or maybe even in our 80s, and we've got some clients who are in their 90s as well. What it means is that the muscles that we have left, the muscle fibers that we have left, they're really trying to do the same job that more muscle did 5, 10, 15 years ago. Okay, so what we see an awful lot of is it's not a lack of walking. Most people are terrific at doing their walking and getting their steps in up until the point that they start having issues with balance and falls. And then what tends to happen is they start shrinking their activities in their life because they're not confident to get out and about anymore. And that tends to be a vicious circle at that point, and where it becomes more of an inactivity-driven frailty problem. But what we see with people is very often that there's huge amounts of potential there for being able to get stronger, fitter, more active. It's about breaking that cycle so that we can get you moving better, get you strengthened up more to be able to get more confident on your feet. One of the frustrating things about confidence is if you've lost it, you can't get it back. You can't wait to get your confidence back before you do the thing. You tend to have to do the thing safely and repeatedly for you to build your confidence back up. Okay, that's where we come in, and we do loads of work with people to help get them more confident on their feet by improving their strength, their balance, get them practicing things that they don't like doing. And then we see really, really nice improvements in somebody's mobility and independence. Okay, on to the exercises today. So this is covering a few different areas that we see big challenges with, especially in a population of people who have issues with falls. Okay, the first one that we're going to work on today is thigh strengthening. So your thigh muscles, these ones here, are obviously hugely important in being able to keep you upright against gravity and keep you on your feet and walking safely. Okay, so what you can do is buy some ankle weights off of any online retail store so that you can strap them around your ankle and get these muscles a bit more resistance to work again. So the exercise is dead easy. It's straightening your knee, bring that foot back down. Straightening your knee, bring your foot back down. Depending on the weight that you're putting on your leg and ankle, you could be doing anything between 8 to 15 repetitions, then change and do it on the other leg. Okay? As a general rule of thumb, 3 sets, so 3 times for doing this if you've got weights on. If it's unweighted, you can do this quite considerably more. So you might be looking at doing maybe 2 to 3 minutes on one leg and then changing 2 to 3 minutes on the other. Okay, so the next one that we're going to work on is sit to stand. Okay, so a good stand up and sit down is very much like a squat, but with a wee rest in the middle. Okay, so it's really, really good for strengthening up your thighs, good for strengthening up the back of your back of your legs here, and then at your bottom too. So a sit to stand, if you need to hold on, please hold on and push up to start with, and gradually build yourself up to being able to do it without holding on. One of the biggest issues that we see with people doing sit to stands and using sit to stands as an exercise is they tend to push back like this and then lever themselves up, which basically means your legs have done pretty much nothing. So you're not getting very much effort going through your legs to be able to get yourself up on your feet. Okay, so what we want to do is much more mimic a squat where it's coming down, hands onto the chair to gently lower yourself down. And then when you're coming up, lean forward to come up. As a rule of thumb, nose over your toes. Okay, so to be able to come forward, we need your nose coming forward to get over your toes to allow you to stand up properly, pushing down through your heels. Okay, none of this, by the way. We see lots of people pushing into the chair to lever themselves up like that. That's not what we want to see. Now, we've seen people quite commonly where 2 or 3 repetitions of that tires them out and they need to take a break. Other people, you could be managing 10, 15, 20 repetitions. You start where you are, okay? Not where you want to be. But technique, it really, really does matter for that one. Okay, so moving on to the next one. These muscles at the back of your legs here, your calf muscles, are very, very, very important in holding you up against gravity. Now, again, for people who sit for long periods of time during the day, one of the biggest challenges that we see is these get really tight. And so what that means is if you were standing with your legs straight like this, you would actually be on the balls of your feet, on your toes with your heels off the ground. Okay, so what you then do is just push yourself backwards here to accommodate for the tightness, the stiffness in those muscles, and then you tend to find that you have to then have something in front of you to be able to walk because you don't have the ability to come forward over your foot. So this tip here, exercise here, is calf stretches. We all know them, we've all seen the runners, and I'm sure we've all done them in the past as well. Such an important exercise to help improve your balance, improve your mobilities, reduce your risk of falls. The typical one that you see is that runner stretch. 1 foot forward, 1 foot back. Please do this holding on if you do have balance challenges, issues with your balance, okay? And what we want to do, first and foremost, is train tracks. Again, one of the biggest common issues I see is that people do it like they're fencing, and this isn't going to stretch anybody's calf off. Okay, get those 2 feet pointing forward like you're on train tracks, and that kind of distance apart, so it's hip width apart, feet pointing forwards, and you're going to gently work to push that back heel into the ground whilst you're coming forward. So like I said, holding on is really, really important if you do have issues with your balance, so please hold on. Okay, you want to hold that as a comfortable stretch for anywhere between 20 to 30 seconds and do that 5 times. At no point should this stretch be strong or painful. We want you to be able to do it consistently and for long enough to make a difference. So no pulled muscles, no muscle tears, no tendon tears, nothing like that. Okay, this isn't a case of no pain, no gain. It's be sensible. We don't want any injuries because the more injuries you pick up, the longer it takes you to get back on your feet. So the stretch should be somewhere from your knee down to your heel, and it should be comfortable, it should be pain-free, it shouldn't be strong, okay? And we're aiming for 20 to 30 second hold, 5 repetitions. Right, on to the next one. Again, thinking about these muscles at the back here, pretty much everybody that I have come across that has had challenges with balance and falls as they've gotten a bit older is actually really quite weak in these muscles at the back. Even though they're very tight, they're often very weak and not fit for purpose. So this next one is to get them strengthened up. Okay, there's absolutely no point in doing balance exercises where you're standing on one leg if you're tight in and around your ankles and you're weak in your calf and ankle muscles. Okay, so we've got to address those problems first before we start thinking about moving on to single leg stands and balance exercises that way. Okay, dead easy exercise. Up onto your toes, gently back down. Up onto your toes, gently back down. Now, Again, one of the big common mistakes that we see with people is when they come up, they either bend their knees or what they do is swing their hips back and do this. Now, again, normally you would be holding on with this, so please make sure, safety first, hold on if you need to. Zimmer frame, work top, side of a chair, whatever works for you. Okay, so it's this here. Up onto those toes, gently back down. Up onto those toes, gently back down. Pick a number of repetitions that work for you. You might find 5 is absolutely perfect, and any more than that and you start getting sore and achy, start with 5. If you're able to do more, please feel free to do more. You've got to work at a level that's good for you. Get these calf muscles strengthened up, get them used to you moving again and starting to take your load, and you will start to see improvements in your mobility, in your walking, in your balance. Last one that I would really like you to consider bringing into your daily practice is actually a supported forward step. Right? So what we want is a holding on to a worktop or the side of a chair and just practicing stepping forward, up and over, stepping back. Changing legs, stepping forward, up and over, stepping back. Stepping forward, stepping back. What this works is all these muscles that we've just been thinking about working down the back of our leg, it also starts to think about working on standing on one leg whilst you're supported. The other thing that it does is make sure that you're pointing these feet forward and that your legs are actually going forward and backwards. I know that sounds very, very strange, but many people who have challenges with their balance and falls aren't actually 100% aware of what's going on with these legs. So when they think that they're stepping their foot forward, what actually happens is it tends to want to zip over across in front of the other one. So we see that narrowing, that scissoring of legs quite frequently. Our feet standing very, very close together. So get them about hip width apart, couple of bits of tape on the floor so that you know where your feet are going. Step forward to that bit of tape, step back to underneath your hip, changing legs forward and back. 20 to 30 repetitions. If you're able to manage that, absolutely awesome. Otherwise, just do what works for you. If that's starting with 3 or 4 repetitions, excellent, just get started, okay? Remember, nothing changes if nothing changes, especially with your physical fitness and your balance and your mobility. And sadly, what happens is if nothing changes and you're very sedate, you tend to find things get worse. So to break that cycle, just get started with one. Get into the habit of doing one, build your confidence that one to then add in the next one. Okay, if this sounds like something that you or somebody that you care about would benefit from, please get in touch. Our contact details are in the show notes. My name's Fraser Simpson. My physio specialist practice is Simpson Physiotherapy. We provide home visits to all of our clients in and around Glasgow and Stirlingshire. So if you live in those areas, please get in touch, let us know, and we can come out to help. The home visits makes a big difference to many of our clients with balance and mobility issues because they don't then have to try and get out to a clinic. Okay, that's a huge stress, huge hassle for a lot of people. So having us coming to you is a really nice way to make improvements and get the therapy that you need. Okay, have a great day. Again, I'm Fraser, Simpson Physiotherapy, and our contact details are in the show notes. Have a great day.